Okay, so your patient name is Mr. Umar, 26 years old male, came to discuss his problems with you. Please proceed with history and management plan. Examination is gray.
Okay.
Just give me a minute,
Hi.
I'll put the time.
Okay.
Okay, your time starts now.
Okay. Hi, good morning, Mr. Omar. I'm Dr. Maida here. How can I help you today?
Doctor, my nose, it's always blocked and runny.
Okay. Mr. Omar, may I know something more about it?
Yes, doctor, it's been like the last 3 months now, and
Mm-hmm.
most of the days it's getting worse and worse because it's blocked and runny, and mostly
Mm-hmm.
in this season.
Okay. Mr. Omar, is it okay if I will ask you a few more questions about it?
Sure, doctor.
Okay. Mr. Omar, did you mention about season? So which season do you mean?
Doctor, this is spring and sometimes the start of summer.
Start of summer. Okay. Mr. Omar, may I know, is it a unilateral, I mean one side block or two side block?
Both blocked, doctor.
Both block. And do you feel any symptoms like breathing from mouth due to that?
Yes, doctor.
Do you snore at night?
No, doctor.
Okay. And this nasal blockage, did you feel that it becomes relieved due to something by any method?
No, doctor. It's mostly worse when I go outside.
I can understand. And do you feel relief by any mean?
No, doctor. I didn't try
Hmm.
anything. It's just come and I try
Okay.
to stay at home.
Hmm.
Then it gets better.
Hmm. May I know that do you feel cough with that?
No, doctor.
Do you feel any discharge in your throat,
No,
post
doctor.
nasal discharge? Okay. And do you feel sneezing often?
Yes, doctor. Yes, doctor.
Hmm.
So much
Hmm.
is sneezing.
And which time of the day?
Mostly when I'm going outside.
Hmm. Okay. Do you feel headache with that?
No, doctor.
Hmm. And do you feel that your eyes are itchy with that?
Yes, it's very itchy. In fact, nose
Hmm.
and palate is also
Hmm.
itchy and watery
Hmm.
eyes.
I can understand, Mr. Umar, you have been suffering a lot. Tell me, do you have any diagnosed case like the long-standing illness like asthma?
Doctor, I had asthma when I was child, but now it's
Mm-hmm.
better. I don't have to use anything.
What about your skin? Do you feel any skin rashes or dry skin?
When I was child only.
What about did you ever came across with nasal trauma? Any trauma on your nose?
No, doctor.
Hmm. Okay, Mr. Umar, may I know any family history of same kind of illness?
Uh, no, doctor. Just my mother have similar condition. She has hay fever
Hmm.
and asthma.
Hmm. Mr. Omar, can you tell me that do you have to spit many times some discharge in your throat?
No, doctor. It's just itchy sometimes, but no discharge
Hmm.
in
Hmm.
throat.
Okay. Now tell me, do you use any regular medication?
No, doctor.
Okay. And tell me do you smoke?
Yes, doctor.
How often and how much?
Doctor, I don't do a lot. But in this season, I try to just take 2 to 3
Hmm.
cigarettes a day.
Hmm.
But I don't
Hmm.
know why still I am having this condition.
Hmm. Okay. Mr. Omar, tell me, do you have any habit of alcohol intake?
No, doctor.
Okay. Do you consume, like, I want to know about your dietary habits. Any specific diet you take?
No, doctor, in general,
Hmm.
mostly these junk
Hmm.
food.
Any excessive tea or coffee?
No, doctor.
Hmm. And tell me that to whom do you live?
Doctor, I live in a flat and I live
Hmm.
alone.
Hmm. Okay. And did you notice anything special around your flat, especially nowadays? Any construction work?
No, doctor.
Do you have pets at home?
Doctor, my girlfriend has a cat.
So you come across many times with that cat?
Yes, these days I
Hmm.
more often.
Okay. Okay. Any other thing like carpets in your home?
Yes, my house is
Hmm.
carpeted.
Okay. And tell me, Mr. Umar, what do you do for your living?
Doctor, I work in an IT department.
Hmm. And is it a stressful job?
Sometimes, doctor, but these days no
Hmm.
stress at
Hmm.
all.
Okay. Mr. Umar, tell me, what do you think that what's going on with you?
Doctor, I just feel it's a hay fever again.
Could be, we will talk about it. And what is your main concern?
I'm worried that my nose will always be like this, and I need just
Hmm.
long. I don't want
Hmm.
any long-term tablets.
Okay. And how can I help you today?
Doctor, I want something stronger than like these
Hmm.
anti-allergic
Hmm.
medications.
Sure. And is it impacting your life badly?
Yes, doctor, I cannot sleep properly. Like I even am waking up with the unrefreshed sleep.
Hmm. Okay. Um, mm, okay. Mr. Umar, I would like to summarize your condition. Since 2 weeks, you have been suffering from a sneezing and blocked nose. You have noticed that this is more often in pollen season. You have a cat at home and carpets also, and you have a previous history of asthma. You want some strong medication because you don't want any long-term tablets. So your like this problem will be solved. Is it okay or you want to add something?
No, doctor, that's all.
Okay. Mr. Umar, is it okay if I can do some tests for you?
Sure, doctor.
Okay. I want to do your CBC and ESR. And I also want to do your one test which is called skin prick test to determine the allergens. Okay. Is it okay for you? Can you do these tests?
Yes, doctor.
Okay, Mr. Umar, based upon the history and some examination finding, looks like that you have been suffering from a condition which is called allergic rhinitis. Okay, Mr. Umar, did you ever heard about this condition?
No, doctor, it's maybe allergy.
It's kind of allergy, and sometimes this allergy becomes become causes inflammation of your lining inside your nose, and this is called allergic rhinitis, which causes persistent symptoms. But it can be managed with some lifestyle and some medicine. If you want, I can discuss with you. Is it okay?
Yes, doctor.
Okay. Mr. Umar, first of all, that I want you to, because I have noticed that you have some seasonal allergy, especially I think that you have pollen allergy because you have these symptoms in some specific season. Is it possible for you to take care, especially during pollen season? If you are exposed, you are going outside, can you come back home and like change your clothes and have a shower? Can you do this?
Yes, doctor.
Moreover, I have noticed that you have a cat at home and you might be allergic to that. It will be very good idea if you can avoid that cat and also remove carpets from your home for the timing and then check how much your condition is improving. Can you do this?
Okay, doctor, I'll try.
Okay. Moreover, I will advise to when you go out, please wear a mask so you will be not exposed to allergens and also avoid sudden change in temperature from cold to hot room. Will you able to do that?
Yes, doctor.
And also if possible it will be very good idea if you can quit smoking. I'm here to help you. Please take this leaflet, have a read, and then come and we will discuss about it. It will also have a great impact on your health. Is it okay?
Sure, doctor.
Okay. Moreover, I will give you a medicine which is called a nasal decongestant for few days, but not than 5 days, xylometazoline. Can you use that, but not more than 5 days? Then I will give you a nasal steroid, which is mometasone. You can use it for long time, one puff morning, one nasal spray morning, one in the evening, at least for 1 month, and come back to me after 1 month. I will do your nasal examination. I will check your nose, and then I will tell you how much you have to use more, or you have to stop it. But don't stop without asking like advice. Is it okay? Can you do this?
Okay, doctor. That
Okay.
okay.
Hmm. And
Mhm.
also, can you, if there is this persistent blockage, or there is one side blockage, or there is blood from
Time's
the
up.
nose, okay, please
Time's up.
come back. Okay, thank you very much.
Okay.
Hello.
So
Hmm.
yes, yes. Yes. Your next case is this one. Mr. Raj, 48 years old male, came to discuss his problem with you. Please proceed with history,
Hmm.
examination, and management plan.
Hmm. Okay, should I
Your
start?
time starts now.
Okay. Hi, good morning, Mr. Raj. My name is Dr. Maida. How can I help you today?
Doctor, actually, I'm feeling that my there's so much burning in my chest.
Hmm. Okay, Mr. Raj, may I know something more about it?
Yes, doctor, it's been like a few months, like 6 to 7 months. It was coming and going, and
Hmm.
now more like it's affecting
Hmm.
me because I feel like the food just sticks them in the mildly when I eat.
Hmm. Hmm. Okay, Mr. Raj. I'm sorry to know about your suffering. Is it okay if I will ask you few more questions?
Sure, doctor.
Okay, Mr. Raj, can you tell me that these symptoms started suddenly or gradually?
No, doctor, it was off and on. I always have this burning sensation. So I was taking over the counter medication. A doctor told me
Hmm.
to take these capsules for a month or two. I didn't
Hmm.
take it. But now my condition
Hmm.
is getting worse. So I came to take those medications.
Hmm. Hmm. Okay, may I know that which medication you have been taking?
I was taking this antacids.
Antacid. And for how long you took that?
7 to 8 months, doctor.
Okay. And may I know that did you stop it suddenly?
No, doctor, I'm still taking it. But now I
Hmm.
have a lot of burning.
Burning. Okay. Hmm. Mr. Raj, do you feel that your symptoms improved by something?
Yes, whenever I take those syrup, it gets better. But
Hmm.
whenever doctor I'm
Okay.
out eating outside, it gets worse.
Hmm. Okay. And anything which like make it worse, more worse?
Fried food and
Hmm. Hmm.
worse in the evenings and when I'm laying
Hmm.
down after eating.
Hmm. Okay. And Mr. Raj, may I know that do you feel any bad taste in mouth also?
Yes, doctor, so much. I have this
Hmm.
acid taste in mouth, especially when I'm
Acid taste
taking late at night.
late at night. Okay. And may I know that as you said that you have a problem in swallowing. Do you feel a problem while eating solid food or liquid food?
No, doctor, no solid, no liquid. It's just
Hmm.
I feel like all the time burning, making my
Burning.
food
Hmm.
feel
Hmm.
sticky. Yeah,
Hmm. Okay, I can understand.
when I
Okay,
eat
tell me.
quickly.
Hmm, you eat quickly. Okay. May I know that did you ever have a vomiting with blood?
No, doctor.
Okay. And did you ever have noticed any black stool?
No, doctor.
Did you have do you have any abdominal pain?
No, doctor.
Any history of weight loss?
No, doctor.
Are you having any other long-standing illness?
Doctor, I have this high blood pressures.
And which medicine you are taking?
I'm taking Ramipril for it.
Ramipril. Okay. Is your blood pressure under control?
Yes, doctor.
Hmm. Okay. Any other medication you are taking?
No. Along
Okay.
just antacids.
Antacid. Okay. And may I know that do you have like any family history of same type of illness?
No, doctor.
Okay. And you said no weight loss also. Okay. Uh, tell me that do you smoke?
Yes, doctor. I do smoke like 20
Hmm.
cigarettes a day.
Okay. And how often? Since how long?
15 years.
15 years. Did you ever think about quitting smoking?
No, doctor.
Hmm. Okay, we will definitely talk about it, Mr. Raj. Tell me, do you take alcohol?
No, doctor.
Okay, and may I know what do you do for your living?
Doctor, I work as a salesperson and I have to
Hmm.
talk a lot. And
Hmm. Hmm. Hmm.
somehow I have to speak a lot on phone.
Hmm. Okay, and is it a stressful job?
Sometimes.
May I know how much is your height and body weight?
23.
Hmm. And do you get
Sorry,
enough time for
33.
33? Do you get time for exercise and walk?
No, doctor.
Hmm. And may I know about your dietary habits?
Doctor, yeah, just junk food, frizzy drinks, late night coffee and drinks, things like that.
I see. And okay. Are you married?
Yes, doctor, I have two kids at home.
Everything okay at home?
Yes, doctor.
Mm. Mr. Raj, what do you think? What's going on with you?
Doctor, I just wonder, like, is it acid reflux coming in my throat and I have this condition?
Mm-hmm. Okay, Mr. Raj, we will definitely talk about it. And what is your main concern today?
Doctor, I'm worried about like any cancers.
Okay, we will definitely talk about it. And how can I help you today?
I want some tests to rule out any serious cause.
Mhm. Sure. And is it impacting your life badly?
Yes, doctor. Just
Mm.
I'm really annoyed by
Hmm.
this condition now.
Mr. Raj, will you allow me to have a quick examination for you?
Sure, doctor.
Hmm. Okay, Mr. Raj, I will do your general physical. I will sanitize my hand under complete privacy. I will do your general physical examination. Then I will ask you to please expose your abdomen. I want to do gentle palpation and then deep palpation for your to palpate your liver and spleen. And I will also do renal punch. And then I will check your feet and also I will check your throat for any post discharge or any throat redness or any pharyngitis. I will check your lymph nodes also. So anything positive on examination?
Mild erythema in oropharynx. Otherwise,
Hmm.
everything normal.
Hmm. Mr. Raj, based upon your history and examination, first I would like to summarize that you have been suffering from this burning throat and you have this taste of mouth for last few weeks. And you have taken already treatment of PPI, and you are concerned that it could be cancer, and you want to do some proper test to diagnose it. Am I right, Mr. Raj?
Yes, doctor.
Mr. Raj, based upon your history and examination, looks like that you have been suffering from a condition which is called gastroesophageal reflux disease. Um, because you have like a burning since long time, and but it can be managed with some lifestyle modification and some medicine. Are you okay to listen about these things?
Yes, doctor.
Okay, Mr. Raj, as you have already used this medication, first we will talk about your lifestyle. You said that as I have seen, your weight is quite high. Is it okay if you will try to lose some weight? Can you do it?
Yes, doctor. I'll try.
Can you do a regular exercise at least start from 15 minutes and then 30 minutes per day? And please reduce junk food and take a high fiber diet, increase water intakes, fruits and vegetables. Can you do this?
Yes, doctor.
Okay, and also want you to, if you can quit smoking, that will a great impact on your health, because smoking is also a trigger for acidity. Can you do this?
Sure, doctor.
And I also want to advise you, please don't take late night meals, heavy meals, especially at least 2 hours before sleep. Please don't take heavy meals. And For the time being, what you can do, you can take a like big pillow or at least two pillow to alleviate your head, and so you won't feel like burning sensation in your throat, and especially in the morning. Will it work? Can you do this?
Sure, doctor.
Okay, Mr. Raj, I want to do some investigation for you. Can I do that? Some investigation.
Sure, doctor.
I want to send your CBC, your fasting blood sugar level, and I want to test your stool for H. pylori antigen. Once your reports will come, I will decide about your medicine. Is it okay if we can wait till your reports will come?
Okay, doctor.
Because I think that you are not taking PPI anymore, because before having this test, you are supposed to stop PPI. So, am I right? Are you not taking PPI?
Doctor, I never took PPI.
Oh, you never took
Only
PPI.
NPC.
Okay. Oh, I'm sorry.
Yes.
I thought that you already took a course of PPI. Then, Mr. Raj, what I can do, I can give you omeprazole 20 milligram morning, 20 milligram night.
And sir.
Okay.
Okay.
Mm.
Your next case is Mr. Daniel, 55 years
Mm.
old male. Can we discuss his problem with you? Please proceed with history and management
Mm.
plan.
Mm.
Examination is gray. Time starts
Mm.
now.
Okay. Hi, good morning, Mr. Daniel. I'm Dr. Maida. How can I help you today?
Doctor, actually, my hands have started to shake and it's getting really embarrassing.
Hmm. Okay, Mr. Daniel, may I know something more about it?
Since 2 years, doctor, it's been coming and going. At first, I was ignoring it and slowly it's worsening. And mostly
Hmm.
when I'm using my hands,
Hmm.
such as holding a cup or writing or using cutlery, then
Hmm.
it is worse.
Hmm. Hmm. Okay, Mr. Daniel, is it okay if I will ask you a few more questions about it?
Sure, doctor.
Hmm. Mr. Daniel, do you feel that this tremor or this shaking of hands gets better with anything?
No, doctor, just when I'm resting, it gets better a bit.
Hmm. Hmm. And how it aggravates?
I don't know, doctor, it just keeps on coming when I'm doing
Hmm.
something.
Hmm. Hmm. Okay, and tell me, is it on one hand or both hands?
Both hands.
Okay. And did you notice any other signs with that? For example, like stiffness in your body?
No, doctor.
Okay. And did you notice the like your power of your hands is weak, like you cannot hold things?
No, doctor, I can hold properly. No power loss.
Mm-hmm. Okay. Did you notice that your gait has been affected with that
Your?
gait? Can you walk
No,
properly?
doctor.
Your
Yes,
gait is
doctor.
okay. Mhm. Okay. And did you know? Did you ever had like a problem of fall, sudden fall?
No, doctor.
Mhm. Okay. And did you notice that any incontinence with that? Incontinence of urine?
No, doctor.
Mhm. Okay. And may I know that are you able to manage your daily activities like eating or cooking at
Yes,
home?
doctor. Yes, doctor. Yes,
Mm.
I can do.
Mm.
Just it's a bit shaky when I'm doing.
Okay, okay, okay. And dressing, undressing, everything is you are able to
Mm.
do. Hmm. Okay.
Yes.
And are you able to drive also?
Yes, doctor, I'm able to drive.
Okay, okay. And did you ever notice any weakness in any part of the body?
No, doctor.
Mhm. And do you have any long-standing illness?
Yes, I have this high blood pressures.
Okay, which medicine are you taking?
I'm taking Ramipril 5 milligram once daily.
Ramipril 5 mg. Okay, is your blood pressure under control?
Yes, doctor.
Mhm. Okay. Any other long-standing illness other than blood pressure?
No.
Mhm. And do you know that any family history of same type of illness like shaking of hands?
Yes, doctor. My father and paternal grandfather had the similar
Mhm.
condition.
Mhm. Mhm. May I know how they are doing now?
They're fine. They put on some medication. My father is on
Mhm.
medication.
Okay. And may I know that if you have been smoking?
Uh, Occasionally, like two to three
Hmm.
cigarettes when
Hmm.
I'm with friends.
Hmm. What about alcohol intake?
Doctor, I am a drinker, like 1 to 2 units most evenings.
Hmm. Okay. And how about any recreational drugs?
No, doctor.
Hmm. And whom do you live?
Doctor, I live with my wife and one kid, and I'm working as
Hmm.
an accountant.
Are you able to manage your job easily with this tremor?
No, doctor. Actually, when I'm writing and pouring drinks in the
Hmm.
meetings, it's really
Hmm.
embarrassing for me sometimes.
I can understand your worries, Mr. Daniel. I'm here to help you. Tell me that is your job stressful?
Yes, doctor. Sometimes it is.
Mhm. May I know about your dietary habits?
Doctor, I eat very little, but I'm
Mhm.
trying to lose just weight.
Okay, you're trying to lose weight. And may I know how much is your body weight according to your height now?
It's 30.
30. Okay, Mr. Daniel, we will definitely talk about this. I'm here to help you if you want to lose weight, but with some healthy lifestyle and some lifestyle modification and some exercise. Okay, Mr. Daniel, is it okay for you?
Sure, doctor.
Okay, Mr. Daniel, tell me that what do you think? What's going on with you?
Doctor, I feel I have Parkinsonism.
Okay, it could be. We will definitely talk about it. And what is your main concern?
Doctor, I'm worried about losing independence and having this brain disease.
Okay, Mr. Daniel. I hope it won't happen. Tell me one thing. How can I help you today?
Doctor, I just want some diagnosis information and any medication to reduce this.
Okay, sure, Mr. Daniel. Tell me that is it affecting your? You told me that it's affecting your job. Anything else like it's affecting badly?
It's only job, and I'm embarrassed. That's all. Personal life.
Hmm. Okay, okay, Mr. Daniel, tell me. I want to summarize your condition. Since few months, you have been suffering from tremors in your hand, shaking hands, and like you, it's embarrassing for you, especially during your job when you have to do writing work, and you are afraid that it could be Parkinson, and you don't want to be dependent on people, and you want me to help with some medicine. Am I right?
Yes, doctor.
Okay, thank you, Mr. Daniel. Will you allow me to have a quick examination for you?
Sure, doctor.
Okay, Mr. Daniel, I will sanitize my hand and I will, under complete privacy, I will do your general physical examination. I will check your pulse, temperature, your hydration status. Then I will do a small test of the memory test. I will tell you to draw something on a paper like a clock and draw some time. Then I will do your gabular reflex. I will check your tone, upper limb and lower limb. I will check your sensation and I will check your power and I will check your reflexes, all reflexes like tricep, bicep, knee reflex, and ankle reflex. I will check your sensation in all four limbs. Then I will ask you to do prayer test for me and Phelan's test. I will ask you to please walk for me, turn around, and that's it. So anything positive during examinations?
Okay. Posture and action tremor of both hands. Fine to
Hmm.
coarse, worse when arms extended or during the finger
Hmm.
nose test, improves at rest. Normal gait,
Hmm.
otherwise, no any
Hmm.
significant finding.
Hmm. Hmm. Okay. Mr. Daniel, as I have examined you and your history, looks like that you have been suffering from Parkinson's disease, same like as your father, and you already aware about this. But of course, this disease has no absolute cure, but it can be managed with some lifestyle and some medicine. So, is it okay if we will discuss about it?
Doctor, I have this brain disease.
Parkinsonism disease, like it's a disease in which it affects a part of the brain due to some chemicals that causes the movement and coordination problem, but it can be controlled with some medication.
Oh my God, doctor, I didn't want to have this.
Yes, Mr. Daniel. I know your worries, but it can be controlled with some with medication. I hope that it will work for you. Is it okay if I will give you some like lifestyle modification, and I will refer you to neurologist for starting treatment as soon as possible?
Yes, doctor.
Hmm. Because I want to refer you, your neurologist will do some of your tests, for example, EEG or maybe nerve conduction studies and some basic test. And moreover, I will give you advice that once you will be over with the consultation with your neurologist, please come back to me. We will definitely talk about your weight reduction, your smoking and alcohol intake. I will tell you that you have to do pneumococcal and flu vaccine, especially because with this medicine, it's better to have vaccine to so avoid any infection in future. Is it okay, Mr. Daniel? Are you following me?
Yes, doctor.
Okay, and specialist will you may give you a medicine which is called levodopa. It's a dopamine agonist, and it has some side effects, but and it because it will start its action, but slowly. It will have some side effects, and you may have some complication later on. But if you will be compliant and do some like lifestyle modification, I hope that you will
Stand up.
prove better. Okay, thank you, Mr. Daniel, for your cooperation.
Thank you, doctor. Okay, just give me a minute. Yes, Dr. Maida. So let's go from first case. This was your third, right?
Yes, it
In
was my
all of
third
the
case.
cases, I was noticing that 7 minutes of history or either 6:30. History was quite prolonged.
Mm-hmm.
If you can do it under the 5 minutes, it will be very nice because sometimes on examination centers, it takes 2 minutes
Mm-hmm.
for examination. So this
Right.
will be difficult for time management.
Yes,
Did
yes,
you ask for chaperone and privacy in
yes.
every case?
Privacy. Yes.
Okay. Because in the last case, I didn't hear. Otherwise,
Mm-hmm.
in first case, what was your
Mm-hmm.
first case?
It was
Allergic
Mr. Umar,
rhinitis?
26. Yes, allergic rhinitis.
Yeah, allergic rhinitis. So you went well through all of that. History taking was nice. In that case, testing is not required basically. Allergic rhinitis is your
Mm-hmm.
clinical diagnosis. You
Clinical,
asked about
yes.
duration, symptoms, itching, but
Mm-hmm.
pattern, trigger.
Mm-hmm.
Trigger should be asked like dust, any
Mm-hmm.
going outside or any pet, and carpet.
Mm-hmm.
These four, and then enough.
Mm-hmm.
And also, if the patient, if this patient was a smoker himself, but if it's a
Mm-hmm.
non-smoker, we can ask about the other
Mm-hmm.
passive smoking, like people working in the same environment with the smoking.
Mm-hmm. That's it. Yeah.
Okay, you didn't do examination there, even though it was a gray examination.
Great.
You could go.
Yes.
Yeah, you could have gone because unilateral
Mm-hmm.
nasal blockage or
Mm-hmm.
any polyps, you can find things like that.
Yes.
Just one
Mm-hmm.
minute. Okay, so in examination, there was pale, boggy nasal mucosa. Anyhow, this
Hmm.
was completely a case of allergic rhinitis. Investigation should
Hmm.
not be done in this case. Directly jump onto the management plan by explaining the diagnosis, likely allergic rhinitis,
Hmm.
and most probably because of seasonal and some perennial component. If you are
Hmm.
allergic to pollens, dust, and carpets, and
Hmm.
the cat. You addressed
Hmm.
everything well over here, but you gave only 5 days of decongestion. It can change into 5 to 10 days,
Hmm.
max, not more
Hmm.
than 10 days.
Hmm.
And
Okay.
oral histamine wasn't given. The case couldn't finish because you didn't give oral medication, right?
Hmm.
Oral
Yes, I did not.
antihistamines for his allergic. If he has
Yes.
allergic
Hmm.
eyes, sneezing, then
Yes.
we have to prescribe,
Right.
and especially when covering or having the face mask important in
Hmm.
every allergy cases. When going
Hmm.
out, try to cover your face, try to wear the
Hmm.
glasses or
Hmm.
goggles to prevent yourself
Hmm.
from any allergies outside, and then coming back and closing, or don't keep ventilated the houses, keep your doors closed, because sometimes people think that opening that having a good fresh air will relieve their symptoms,
Hmm.
but no,
Hmm.
safety netting wasn't
Hmm.
done at the end. Your next case was,
Safety, yes. In safety netting,
yeah,
I think I mentioned that if you have unilateral blockage or bleeding from the nose, I think I only told this
mhm,
one. Just come to me.
okay. But even
Hmm.
if you don't get time to finish, you can say if your
Hmm.
symptoms worsen or you don't get
Worsen.
better, then prevent.
Yes, exactly.
Otherwise, yeah, otherwise this was nice case. Next was,
Hmm.
your second case was GERD, Dr. Maida.
Yes,
Even though
good.
patient had nothing, he had hoarseness of voice. He didn't
Oh,
ask for it.
yes. Yes, I did not ask.
Yeah,
Hmm.
and this patient ignored it himself because also he was working as
Hmm.
a salesman and shouting
Hmm.
and talking a lot on phone,
Yes,
so he was
yes.
ignoring it until you asked the patient. So
Yes.
intermittent hoarseness, and now it was more. If you would have
Hmm.
asked about more like since when it's going on, he would have told you. But he will be
Hmm.
like, it's normal. It's when I'm talking on the phone. But he has
Hmm.
hoarseness. So in this
Hmm.
case, it's a kind of red flag.
Hmm.
There was no dysphagia, no weight loss, no throat lump or pain or and hematemesis or melena. So still we can start on the medications, but also referring the patient. And
Hmm.
he never tried for any medication like PPI especially. So
Hmm.
trial of
Hmm.
PPI can be given in this case.
Hmm.
You did renal punch in the examination. Why?
Um, just by mistake.
Okay, because I thought maybe I don't know about
No,
something.
no,
So
it's not
renal punch
related. Yes.
not related here, and reports doesn't need to be done. Only start of the PPI trials and the
Hmm.
referral for the ENT in if the hoarseness persists beyond 3 to 4 weeks despite
Hmm.
treatment.
Hmm.
How management plan, as everybody knows, it's mostly GERD. So explain what is it and what lifestyle modification, weight reduction, smaller meals. Don't
Hmm.
lie flat
Hmm.
after taking the meals.
Hmm.
Smoking cessation. I guess you just touched non-pharma, not a lot, only for food and weight reduction. We
Hmm.
need to
I
tell
told
them
him to
more
take
food.
two pillows at night,
Yeah.
and don't take large meals at especially 2 hours before sleep.
Okay. Okay. Then
Hmm.
it's fine. And tell him about the voice care. Don't shout a lot and
Yes,
things like
that
that.
part I missed. Hoarseness I
Yeah.
missed.
Yeah. Hoarseness is important. Third case
Hmm.
was essential tremors.
Essential tremors.
Yeah, patient was having tremors on doing any work. It was intentional, but it was minimal at rest. Any tremor that's bilateral, we need to know about association with the alcohol. He was taking alcohol. We could have asked, like, do you feel better after taking alcohol?
Better.
He was getting relieved after taking alcohol, and it also has family history. It also has similar condition, but regardless, like
mm,
there wasn't any stiffness, any slowness of the movement, or any gait problems. Never fell. Okay, so this was essential
mm,
tremors. It comes in exam a lot, and patient always worries about the Parkinsonism because Parkinson is a brain disease, while essential is not a brain disease. It's just we can explain that, and we need to reassure the patient over here. Did you screen
okay.
for thyroid, like any palpitations, etc.?
Yes, I forgot. I came to like it came in my mind hyperthyroidism, but I forgot to ask.
Hmm. And
Okay.
gait and incontinence, we cannot ask about this to the patient. They will
Mm,
ask like, "What is it, doctor?" We will say any
mm-hmm,
difficulty in urine and bowel, and any
mm,
difficulty walking or any change in
okay.
walking.
Okay. Mm,
And alcohol, yeah, and every time you have this tremors, we need to know any other part
mm,
of your body have the similar condition or only
mm,
hands.
mm,
So his neck
mm,
was also having the tremors. So if you asked about any other part, he would have said, yes, my neck feels. So this is directly essential tremors.
okay.
We'll pick from the start.
Okay. Okay. Mm-hmm,
There was
mm,
no mood changes, no cognitive change, and no
mm,
hyperthyroid symptoms. If you would have asked about weight loss, heat intolerance, or palpitation, any of these, he wasn't taking any drugs also.
mm,
So,
mm,
investigations, basic screening is needed, otherwise, not required. Basic screening like thyroid function, urea electrolyte, LFTs, CBC, and glucose, just to rule out if hypoglycemia, you are considering hypoglycemia then.
mm, mm,
And but diagnosis of essential is largely clinical. We just need to refer for neurology for if there is an atypical or if
mm,
you are not sure of its essential tremors. So tell him that it is essential tremors and mostly it's postural, or when you are doing something, it's family history. In your
mm,
family, it's also there, but it's not a brain disorder. And it's
mm,
relatively common, but it's not Parkinsonism as you are worried about. How
mm,
we will
mm,
manage this patient by giving practical advice, not to
mm,
tell him to overuse the alcohol because it relieves, just tell him like use of heavy cutlery or cups and
mm,
avoid caffeine and stimulants if he's taking. Occupational adjustment can be done because here we need to refer him for occupation therapy
mm,
because his work is about hand and he's suffering from it. So
mm,
or either he can use larger pens or any technology.
mm,
For that, we have to refer pharma. Mostly beta blockers, propranolol can be started,
mm,
and alternative is primidone. But it's
mm,
started by the specialist, not GP.
mm,
Also, before starting the propranolol, we need to know if he's asthmatic or not.
mm,
Otherwise, yeah, this and the history before was 6:30. Otherwise, it was like otherwise you are doing good, touching every point.
mm,
But try to like rule out other DDs when you get one a
mm,
fixed diagnosis in your mind. Then still we
mm.
have to ask about others.
Yes, actually, the
Okay.
big distractor in
Yeah.
this case was family history. And second thing,
Yeah.
when I asked patient, do you feel that tremors relieved by something? I might should have asked that, do you feel that alcohol relieves your tremors? So my question was not correct. That's why patient did not reply properly. So
Yeah.
that's why
Yeah, because
I mentioned.
sometimes patient doesn't know. They think that this alcohol relieves the stress, and then they just go and sleep at
Mm,
home. They don't really
yes,
bother. It's if it's getting better. So
yes.
head and
Mm,
arms tremors, head and hands tremors, and along with the family history with alcohol, it's essential tremors.
mm, mm,
Okay, so
mm,
Dr. Farheen.
Yes, doctor.
Okay, so your first patient is Take the case. Mrs. Karen, 52 years old female, came to discuss her problem with you. Please proceed with history, examination, and management plan. And
Mrs.
your
Karen.
time. Yes, your time starts now.
Okay. Good morning, Mrs. Karen. I'm Dr. Fareen. How can I help you today?
Doctor, actually, my left leg has become swollen and sore over the last few days.
Mrs. Karen, can you tell me more about it?
Since 3 days, doctor, I'm feeling this dull ache and tightness in left side and left calf, and worse on when I'm walking. And it's getting bigger than the right one.
Okay, Mrs. Karen. So sorry to hear about that. I just want to ask you more questions. Is that okay?
Sure, doctor.
Okay. So since how many days you are facing this problem?
Since 3 days now.
Since 3 days. Okay. And is it started all of this suddenly?
Yes, doctor, suddenly I'm starting swelling up.
Mm-hmm. And uh, do you have pain in the leg?
Yes, doctor, I'm feeling so much pain when I'm walking.
Okay. Okay. So, Mrs. Karen, may I know that is it involved? Is it? Do you have pain in the whole leg or is in the specific part?
Calf muscles, mostly.
Mostly on the calf muscles. Okay. If I'm asking on the pain scale, like how severe your pain is, like 10 is the most severe and 0 is least severe, then how you can score it?
Doctor, it's like 6 to 7
Mm-hmm.
when I'm
And
walking.
what? Okay. And what type of pain is this?
Dull ache.
Dull leg pain. Okay. So, Mrs. Karen, anything that aggravate your pain? You told me that walking aggravate your pain. So, anything else?
No, doctor.
Okay. And anything that gives you relief?
Just resting.
Just resting. Okay. So, Mrs. Karen, did you take any medicine for it?
Only paracetamol, doctor.
Okay. Okay. So, Mrs. Karen, may I know, do you have fever along with that?
No, doctor, but the area is very hot and red.
Mm-hmm. Okay. So, I can see, Mrs. May can I have a look right now?
Only on examination. Should
Okay.
I tell
Okay.
you?
So, Mrs. Okay, I will do on the examination.
Okay.
Okay. So, Mrs. Karen, may I know, do you have any shortness of breath?
No, doctor.
Any history of chest pain?
No, doctor.
And within the past 3 to 5 days, do you have any long flight, like more than 5 hours?
Yes, doctor. I just got back a week ago for long haul
Mm-hmm.
flight for 8 hours now.
Okay, okay. And are you taking any contraceptive pills?
Yes, COCPs.
Okay. And since how many months are you taking these pills?
Since 2 years now.
Since 2 years. Okay. Okay. So, Mrs. Karen, do you have any recent surgery?
No, doctor.
Okay. And is there any recent illness that you stay on the bed for a long period of time?
No, doctor.
Okay. Okay. So, Mrs. Karen, okay. So, do you have any long-standing illness?
Yes, doctor. I have this migraine problem.
Mm-hmm. And how your migraine is like? Are you taking any drugs for it?
I only take Brufen sometimes. And doctor, I know this medication shouldn't be taken with this, but my doctor gave me. He said, without any other noise or any other disease, I can take this COCPs.
Okay, okay. So, Mrs. Karen, may I know, are you taking any other drugs on regular basis apart from COCP and Brufen?
No, doctor.
Okay. And is any member of your family affected with uh, any type of like any heart disease?
No, doctor.
Okay. Any clotting, any clots in the blood?
Yes, doctor. My mother had clots in her legs when she was in 60s.
Mm-hmm. And how it is now?
She's fine doing on drugs.
Okay. And have you ever diagnosed with any clots in the blood?
No.
Okay. So, Mrs. Karen, what do you do for living?
Doctor, I'm not doing anything for, I live at home, just housewife.
Okay. And do you smoke?
Yes, doctor, I do like 10 cigarettes a day.
Have you ever tried to quit it?
No, doctor.
Okay, so Mrs. Karen, it's not good for your health. So if you ever make up your mind and want to quit it, just come back to me. I will be here with you. Okay, I will tell you each and everything in detail how to quit it. Is that okay?
Sure, doctor.
Okay. Do you take alcohol?
No, doctor.
Okay. So Mrs. Karen, are you married?
Yes, doctor, I have 3 kids.
Okay. So when was your last menstrual period?
Doctor, it's been 1 year now almost.
Mm-hmm.
I didn't get my periods.
Okay. Okay. So and you are still taking COCP pills, right?
Yes, doctor.
Okay. So Mrs. Karen, do you have any idea what's your last BMI, weight according to your height?
31.
31. Okay. Have you ever tried to lose your weight?
No, doctor.
Okay. So, Mrs. Karen, what's crossing your mind?
Doctor, I feel like this is a muscle pull.
And anything that worries you most?
Yes, doctor. Since my mother has this disease of clots, I'm also worried about it.
Okay. I can understand that, how difficult must be for you. Mrs. Karen, how far this thing impact your life?
Doctor, just since 3 days I cannot do anything. So just I thought I can come here ask you what's going on.
Okay. And what do you expect from me, Mrs. Karen?
I scan.
Okay. Okay. So, Mrs. Karen, I will tell you each and everything in detail. Okay. So, I will just summarize it. You told me that you are having this black pain on your left side and swollen pain in your left side of your leg since 3 days. And you are so concerned about that your mother had the similar problem. Your mother had clot in the blood, this type of problem. And you are so concerned about this. Anything else that you want to add?
No, doctor.
Okay. So, Mrs. Karen, I just want to quickly examine. Is that okay?
Sure, doctor.
Okay, so in the presence of the chaperone and after sanitizing my hand, I will start the examination, checking the vitals first, BP, pulse, temperature, and respiratory rate. And I will start with the general physical examination, checking anemia, jaundice, pulse, and uh, and I will check the I will also check the cardiovascular examination, and I will check the basis of the lungs also. And I will also palpate the both of the calf muscles. First, on the unaffected leg, I will check. First, inspect both of the legs, and then palpate the leg, checking compare the temperature of both of the leg. And then I will palpate the legs and checking the edema.
Okay, doctor. Blood pressure 126/78. Patient is afebrile, left leg calf swollen compared to the right, mild erythema and pitting edema to mid calf.
Okay. So, Mrs. Karen, after taking history and after examining you, most probably you have a condition which is called DVT. Do you have any idea about this?
No, doctor.
Okay, it is basically the condition in which the blood clot is formed in the blood pipes which are carrying blood back to the heart. Sometimes the blood clot form in the legs, and there are multiple reasons behind this. And most likely, in your case, the reason behind this, you are taking COCP pills for the 2 years, and for you took long flight. So this is the reason that you are having these type of symptoms. Are you getting my point?
Yes, doctor.
So right now, I'm just refer you to the specialist emergency, and they will do ultrasound Doppler within urgently. And if the ultrasound Doppler will not be available, then they will do D-dimer test, and then a specialist will start a drug which is direct oral anticoagulant. Are you getting my point?
Okay, doctor.
Moreover, I just want to stop your COCP pills and then switch it to the other method. I'm just giving you a leaflets about this. And as your periods are stopped by 1 year, so I think there is no need for the other method, but you can still use condom if you want. Is that okay?
Sure, doctor.
Moreover, if just right now I'm just making a referral letter for you and arranging an ambulance for you. Is there anyone who is with you?
No, doctor, I came alone.
Okay,
I drove
so one of
myself.
my staff members. Okay, so you just keep your car here in the clinic and just park here, and then one of my staff member will accompany with you. Okay, and just after visiting the yeah, emergency department or specialist, just come back to me. We will calculate your Chadwick score, and then
Thank God.
according to which specialist will start using. So
Okay.
anything else you want to ask? Thank you.
So your next patient is Mrs. Hannah, 33 years old female, came to discuss her problem with you. Please proceed with history, examination, and management plan. Your time starts now.
Mrs. Hannah. Okay. Good
Hmm.
morning, Mrs. Hannah. I'm Dr. Fareen. How can I help you today?
Doctor, actually, my hands are red and itchy.
Mm-hmm. Mrs. Hannah, can you tell me more about it?
Yes, doctor, it seems like it's getting worse, and since 6 weeks, on the back of my hands and fingers, and on wrist,
Mm.
sometimes I'm getting so much itchiness, and it's cracking also.
Okay, Mrs. Hannah, so sorry to hear about that. May I have a look at your hands?
Sure, doctor. I'll stop the timer, Doctor Pari. Just give me
Okay.
a minute.
Hmm.
Okay, can you see?
Okay. Okay, can I start?
Yes, I start again.
Okay, so Mrs.
Yes, I
Hannah,
start.
may I know about more about your condition? Can you tell me in detail?
Yes, doctor. It's mostly itching, burning, dryness, and sometimes these cuts come and goes, and sometimes it's weeping also, and worse
Okay.
at the end of the day.
Okay, so Mrs. Hannah, I just want to ask few more questions. Is that okay?
Sure, doctor.
Okay, so Mrs. Hannah, may I know since when you are having these type of symptoms started?
6 weeks.
Okay, since 6 weeks. And is it start all of the suddenly?
No, doctor. It was starting gradually. It was itchy. I was ignoring it. Then it went worse now.
Okay. Okay, so Mrs. Hannah, is this on both of your hand or only on the one hand?
Both hands.
Both hands. Okay. Anything have you noticed that aggravate your symptoms?
Doctor, I work as a hairdresser and I'm
Mm-hmm.
using some new products. I don't know if it's
Mm-hmm.
because of it.
Okay. So, are you using these new products in 6 weeks?
Yes, doctor, I started using this.
Okay. Okay. And have you noticed that anything that relieve your symptoms?
No, doctor, but on the weekends it gets better.
Okay. Okay. So, Mrs. Hannah, okay. So, did you take any medicine for it?
No, doctor.
Okay. And is itching improve your, give you relief?
Mm, yes, doctor, it's just itching is relieving when I'm.
Okay. So Mrs. Hannah, do you have any skin allergies?
No, doctor. Only when I was
Okay.
child I had this eczema.
Okay. And are you a diagnosed case of any skin disease?
No, doctor.
Okay. And Mrs. Hannah, is any member of your family affected with the similar illness?
No, doctor.
Okay. Okay. So Mrs. Hannah, do you have any long-standing illness?
No.
Okay. And do you have any allergies, like any history of skin allergies?
No, doctor, only when I was
Oh,
child.
okay. When you were a child, what type of allergy do you have?
Only eczema when I was child.
Eczema. And was it controlled or improved with time?
Yes, doctor.
Okay. Okay. So, Mrs. Hannah, are you taking any drugs on regular basis?
No, doctor.
Okay.
Hello.
Okay.
Hello.
Okay. So, Mrs. Hannah, oh, okay. Sorry. My mic was mute. Oh, sorry. Okay. Mrs. Hannah, what do you
Okay.
do for, you told me that you are a hairdresser, right?
Yes, doctor.
So, is this thing affect your life, like work?
Yes, doctor. It's just I'm always itchy. I have to like stop my work, do itchy, uh, go for itching and washing my hands. Then I come back.
Okay. I can understand that how difficult this must be for you. Mrs. Hannah, do you smoke?
No, doctor.
Do you take alcohol?
No, doctor.
Any other recreation drugs?
No, doctor.
Okay. So, Mrs. Hannah, are you married?
No, doctor.
Okay. So, Mrs. Hannah, when was your last menstrual period?
It was 3 weeks ago.
3 weeks ago. Okay. And I just want to ask a private question. Are you sexually active?
Yes, doctor. I have a partner.
Okay. Okay. So, Mrs. Hannah, do you have any idea what's your weight according to your height?
24.
24. Okay. So, what's crossing your mind, Mrs. Hannah?
Doctor, just this eczema maybe again coming back like my childhood.
Okay. Anything that worries you most?
I'm worried that I might have to change my job.
Mm-hmm. Okay. And what do you expect from me, Mrs. Hannah?
Doctor, just I want to know what is this condition and how can it gets better?
Okay, I will tell you in detail. Mrs. Hannah, how you told me that this is affecting your job, right? Anything else that is affecting you?
No, doctor.
Okay, so Mrs. Hannah, I just want to quickly summarize it. You told me you are having itchiness and this type of lesions on your hands in 6 weeks, and you recently changed you are work as a hairdresser, and you are using some of the chemicals. So you have noticed these type of the lesions, and you thought that there must be some eczema. Is there anything else you want to add?
No, doctor.
Okay, so I just want to quickly examine you. Is that okay?
Sure, doctor. Examination picture given, otherwise normal vitals.
Okay. Okay. So, Mrs. Hannah, after taking history and after looking at your hands, most probably you have a condition which is called contact dermatitis. Do you have any idea about this?
No, doctor.
Okay, so basically, it is the condition in which some of the, it is the condition that occurs due to allergy to some of the products. Like in your case, you are allergic to, you have recently changed your, you are working with the dye as your hairdresser. So this thing aggravate your symptoms. Are you getting my point?
Oh, okay, doctor.
And as you are concerned that you have also childhood eczema, so it is basically the type of the eczema, and that's why your skin are so much sensitive, and that's why you are having these type of the lesions. Is that okay?
Yes, doctor.
So, Mrs. Hannah, how about this avoid working with the chemicals and just change the nature of your job? Is this possible?
No, doctor. I have this only job.
Okay, so I can write a letter to your manager so maybe he can change the nature of your job.
Okay, doctor.
Or you can, otherwise, you can use gloves, okay, so that your hands will be protected, okay, and just don't keep your hands dry and just moisturize all the time. How about that?
Sure, doctor.
Okay, and moreover, I am just giving you steroids, which is hydrocortisone, and 0.1%. You can apply it on the hands, okay? And first apply it, and then after half an hour, you can apply the moisturizer also. Okay.
Okay, doctor. Okay.
Okay, so I'm also giving you a thick emollients. You can apply it on the hands so that your hands will not get cracky. And I'm also giving you antihistamine, which is tablet cetirizine, 10 milligram. You can take it at the night. It will relieve your itchiness. Are you getting my point, Mrs. Hannah?
Okay, doctor.
If in case your symptoms are not improved and it will badly affect the quality of the life, then you have to come back to me immediately. Then we will send you to the specialist and we'll do some of the skin allergy skin tests.
Okay, doctor.
Okay, so is there anything else you want to ask?
Doctor, how to use these steroids?
Okay, so you can just wash your hands and then apply steroids on your hand. Okay, like you can use one fingertip till the
Mm.
mark on your fingers. Like you can use it, and you can use one fingertip and apply both on like on the palms and back of the hand. Okay, and the same pattern apply on the other hand. Are you getting my point?
Okay, doctor.
And after half an hour, you can apply thick emollients. I'm just giving you. And if you think that the emollient is so much thick, then we can switch it to the other things like creams and lotions that is less, sticky. Okay. But don't
Sure,
don't
doctor.
uh, suddenly stop this and just follow up after the 2 weeks. Then we will check if their symptoms are improved or not.
Okay, doctor.
Anything else you want to ask?
No, doctor. Time's up.
Okay, thank you.
Dr. Fareen, did you tell when to come back?
Yes, after 2 weeks.
Okay. So your last case is just 1 minute. "29 years old, female, Mrs. Aisha, came to discuss her problem with you. Please proceed with history and management plan. Examination is gray. Your time starts now."
Okay. Good morning, Mrs. Aisha. I'm Dr. Fareen. How can I help you today?
Yes, doctor, actually, uh, I'm having this pain in right side since 2 days now.
Okay, Mrs. Aisha, can you tell me more about this?
Yes, doctor, it's like it just started suddenly and it's
Mhm.
constant and it's worse on the movement.
Okay. Mrs. Aisha, I just want to ask few more questions. Is that okay?
Yes, doctor.
Okay. So, Mrs. Aisha, do you still have pain?
Yes, doctor, I'm still having pain.
Okay. Can you just point out where exactly your pain is?
In right leg fossa.
In right side. Okay. Okay. So, Mrs. Aisha, can you just lie down on the couch if you are still in the pain? I can give you a painkiller.
Yes, doctor. Yes, doctor.
Okay. Just lie down on the couch. I just want to ask few more questions before giving the painkiller. Is that okay?
Sure, doctor.
Okay. So, Mrs. Aisha, you told me that you are having this pain since 2 days, right?
Yes, doctor.
Okay. So is this pain continuous or on and off?
It's just continuous. but sometimes it's
Continue.
getting worse, sometimes normal.
Okay. So, okay. So, Mrs. Aisha, may I know that is it started all of this suddenly or gradually?
Doctor, it was gradually.
Mm-hmm. And what type of pain is this?
Dull ache.
Okay. Okay. So, Mrs. Aisha, is this pain go anywhere else on the body?
No, doctor.
Mm-hmm. And anything that aggravate your pain
No, doctor.
and
Only
anything that gives you relief?
movement.
Only movement. Anything that gives you relief?
No, doctor, nothing gave me relief.
Okay. So, if on the pain scale I'm asking how severe your pain is, can you just score it?
6/10.
6/10. Okay. Okay. So, Mrs. Aisha, okay. So, do you have this type of pain before?
No, doctor, this is the first time.
Okay. This is the first time. And did you take any painkiller for it?
No, doctor.
Okay. So, is this the type of pain that occurs first in the on the area of the your belly button and then goes towards the right side?
No, doctor, it just started there.
Okay. Okay. So, do you have any history of nausea?
No, doctor.
Any vomiting?
No, and Dr. Fareen, it's constant pain.
It's
No
constant pain.
vomiting.
Okay. Okay. Any history of fever?
No, doctor.
Okay. When was your last menstrual period?
Doctor, actually, it's been 7 weeks now.
7 weeks now. So, did you do any pregnancy tests at home?
Yes, I did one time a week ago. It was positive.
Okay, okay. So, did you go for any gynecologist for checkup, Miss
No,
Aisha?
no, doctor.
Okay. So, this pain is constant since how many hours?
Doctor, since 2 days, it's just constant. I'm trying to bear it, but it's not doing anything. And I didn't take medication because I'm pregnant.
Okay, okay. I can understand, Mrs. Aisha. So, Mrs. Aisha, how many kids do you have?
This is my first time.
Okay. And is there any history of miscarriages before?
No, doctor.
Okay. Okay. So, Mrs. Aisha, okay. So, do you have any long-standing illness?
No, doctor.
Okay. And Mrs. Aisha, first, I just want to examine you right now. Is that okay?
Sure, doctor.
Okay. So I just start in the presence of the chaperone, and after sanitizing my hand, I will check the vitals first, BP, pulse, temperature, and the respiratory rate, and I will also check the start with the general physical examination, checking anemia, jaundice, pulse, and I will check palpate the abdomen, and I will check any tenderness and yeah, that's it.
Normal blood pressure, pulse, afebrile, localized right iliac fossa tenderness, mild guarding, except that it's normal. Did you do any pelvic examination?
Oh no, I just want to do
Okay.
a pelvic examination.
A small amount of blood and cervix closed. Right
Cervix closed.
adnexal tenderness. Yes. And cervical motion tenderness present.
Okay. Cervical motion tenderness positive and right adnexal tenderness.
Hmm.
Okay. Okay, so Mrs. Aisha, are you still in pain? Do you want some painkiller?
Yes, doctor.
Okay. So, okay. So I'm just giving you, are you allergic to any medicine?
No, doctor.
Okay. So I'm just passing an IV line and I'm just giving you a, injection also. I'm just giving you injection diclofenac. Is that okay?
Okay. Okay, doctor.
It will relieve your symptoms. Okay. Sorry, injection paracetamol I'm giving you and it will relieve your symptoms. It will relieve your pain. Is that okay?
Okay, doctor.
Okay. So Mrs. Aisha, I just want to ask few more questions.
Sure, doctor.
Okay. So Mrs. Aisha, do you have any discharge down below?
Yes, doctor, light spotting.
Okay, any history? Okay, and light spotting. And how much blood have you noticed?
Just spotting.
Okay, and how many pads do you use?
Didn't use any pad for it.
Okay. Okay, so Mrs. Aisha, do you have any long-standing illness?
No, doctor.
Okay. And is any member of your family affected with any history of the miscarriages?
No, doctor.
Okay.
Miscarriages?
Any
Doctor, is it a miscarriage?
history of pregnancy loss?
No, doctor.
Okay. Okay, so Mrs. Aisha, are you taking any drugs on regular basis?
No.
Okay. Okay, so Mrs. Aisha, did you go for any ultrasound before?
No, doctor.
Okay. So what do you do for a living, Mrs. Aisha?
I'm housewife.
Mm-hmm. And do you smoke?
No, doctor.
Do you take alcohol?
No, doctor.
Okay. And what's your last BMI? Do you have any idea?
21.
Okay. So, Mrs. Aisha, is your husband supportive? Like, as this is your first pregnancy and specious pregnancy?
Yes, doctor, he's supportive.
Okay. So, do you have any history of fall?
No, doctor.
Okay. Are you taking any multivitamins?
No, doctor.
Any folic acid?
No, doctor.
Okay. Okay. So, Mrs. Aisha, what's crossing your mind?
Just doctor, I feel it could be miscarriage now.
Okay. And okay. So, what do you expect from me?
I'm scared about the baby and my own safety.
Okay. And how far this thing impact your life, Mrs. Aisha?
Doctor, I want a scan to see what's happening with me.
Okay. And anything specific that worries you most? Hmm.
Only this, doctor, I don't want to lose this baby.
Mm-hmm. Okay. Okay. So, Mrs. Aisha, I just want to quickly summarize it. You told me you are 7 weeks pregnant and you didn't go for any ultrasound and you are having this constant pain on the right side of the abdomen and you have noticed mild spotting and you are so concerned that this must be miscarriage. Is there anything else you want to add?
No, doctor, only this.
Okay. So, Mrs. Aisha, is examination required?
You did examination.
Okay, okay. Okay, so Mrs. Aisha, after examining you and after taking history, so there are 2 to 3 things that going on in my mind. Like maybe it's due to the ectopic pregnancy or maybe due to the some miscarriages. But I'm not confirming it right now. I will confirm it after the ultrasound. Are you getting my point?
Yes, doctor.
Okay, so right now I'm just refer you to the emergency department for the ultrasound. Okay, they will do ultrasound and then we will then it will be clear that what's the reason behind this. Is that okay?
Okay, doctor.
Moreover, just visit to your gynecologist. Just make an appointment with the gynecologist also. And after visiting the gynecologist, you can visit to me again, and I will tell you about the lifestyle. And okay, thank you. I got just blank in this case.
I guess you were going back and forth and uh, kind of sometimes it happens near the exam. I can understand.
Yeah.
Okay, so going from the first case was DBT. Uh, Dr. Farheen, in any
Yes.
kind of cases, we just need to know HOPI, one or two associated, one or two red flags, then we move on to the diagnosis. Because as soon as she told you that she's having a swelling and you got that the travel history, a COCP, a high BMI, more likely DBT. So we will just tell the patient we will finish the history as soon as possible because your history was going again 7 minutes, 6:30, and last went I don't know how long. Only these two I could count. 7 minutes or 6:30. It should be like within 5 minutes. When the patient is
Okay.
telling you redness and warmth, you asked about the chest pain, but she wasn't having any chest pain. but breathlessness. And sometimes patient is when she is having high BMI, she would ignore breathlessness and thinking that maybe it's because of my obesity. I'm having breathlessness. Okay, and on examination, did you do calf circumference?
I just palpate the cuff.
Yeah,
Mhm.
palpation of the calf should be only done for edema. No other palpation should be done in this case. And the second thing is circumference of calf. You would know that DVT, it is DVT.
Yes, I
Okay,
just
it's
forgot
more
that.
than its criteria. If it's more than 3 centimeter, then the other calf, then it is definitely a DVT with redness, warmth, pain on walking, significant history of travel, or any COCP or obesity, or any family history associated. So here we will say that you, as you send the patient to the emergency, we need to know few things before admitting the patient, like with whom you came. As you asked, you came alone, she drove herself. I will be connecting you to your supporter, whatever at home might be her husband or whoever is living with her. And yes, what I'm noticing, we don't need to ask, are you married? We need to ask one question, with whom do you live? If she's or he is married, they will tell you about the spouse. If not, they will tell you about whoever living with. Sometimes people are living in alone with partner in hostels. So asking about with whom will you do you live? It's better than asking are you married.
Okay.
Okay. Then Chadbest score. You asked about the Chadbest here. Here, Chadbest score is it
Yes.
needed? Wells score.
Yes.
If you want to
Well, score. Yes.
verbalize like that, and definitely with so many respecters, I also will be concluding your Wells score. You can either say it or just after concluding you on the Wells score. I am suspecting that you are suffering from a condition we call as deep vein thrombosis. Do you have any idea about this? And then you can continue with explanation. Immediate and urgent referral to the emergency department, and also tell her what they will be doing. They will be giving you blood thinners, especially anticoagulants, dogs, and low molecular weight heparin. There are some things we need to talk to the patient, and there are things we need to tell the examiner. So here we need to tell, we know that they will be starting dogs after doing what? After
Mm,
initial assessment of the patient, after imaging.
I have told him that after maybe they will do Doppler or dimer, and after that they will start direct oral anticoagulant.
Yeah. So we need to tell to the examiner that why I am sending this patient there. And if you get time, you can tell that since this was provoked or unprovoked, you will tell about the 3 months and 6 months
Three
period.
months. Yes.
Hmm. And next thing is safety netting. Did
So,
you do
Dr.
safety
Musarraf, shouldn't
netting?
we do Chadwick score before starting the dogs? Like Wells score is
Chadwell
also
is
for the
for
DVT, but
atrial.
for the dogs is.
Chadwell is for the atrial fibrillation as far as I know. For everything there is a scoring system. For DVT it's a Wells
Yes.
score. For Chadwell is for atrial fibrillation to prevent the
Yes. Yes.
stroke.
Okay. Okay.
Okay. It's not necessary to start the dogs. We also have to do Chadwell. No, every scoring system is different for everything else. And if you don't do the circumference here, examiner won't tell you the finding. That is DVT. It could be cellulitis, right?
Can
Okay.
you can we say the orbit score like as we say the in atrial fibrillation for starting the dog they will do the orbit score. Can we say they here also that they will or not they before giving
Yeah, you can say orbit, and there is one more I don't
as
remember
blade
which
or
is.
keels like this type of scores?
Yeah, there are many scores, but here
Hmm.
what we need to tell the patient not about dogs scoring, but about what DVT.
DVT
Wells
scoring.
is
Okay.
scoring, you can say.
Okay. Okay.
Not
Okay.
not any, not so many things. Even I
Okay.
would say Wells, if you get time to tell that, you can tell. Otherwise, you can skip this word also, since you already diagnosed the patient. So if you say it, say it. Otherwise, don't bring a lot of things. It will be difficult for you. The next case was allergic or contact dermatitis. So contact dermatitis, patient directly told you what she's working for, like a hairdresser and using those dyes. Otherwise, if they don't tell you, you need to keep on asking about first thing occupation. What do you do for a living, and are you using any new products, or do you wear gloves while you use these things? And sometimes patient is coming with dishwasher. They are working as a dishwasher in any hotels or anything. So we need to know about the occupation first. They are already allergic in their childhood, either having eczema or asthma. So here, Dr. Farheen, active listening was missing. Like patient already told you, I was having the symptoms since 6 weeks. So a
Mm.
repetition of questions over there. Otherwise,
Yeah.
uh, you got the case and safety netting. Did you do? I
Yes,
think
I do. So I did safety netting. If your symptoms are not
when to
controlled
come
and
back.
it affect the
Hmm.
quality of life after 2 to 3 weeks.
Hmm.
Mm.
And when ruling out any dermatitis or in cases like this, we can just ask, whom do you live with at home? Secondly, anyone at home is suffering from the similar condition. That's it.
Mm. Yes.
Otherwise, it was just went well. A fingertip rule is for one hand. Okay, one fingertip is for one dorsum
Yes.
and the palmar side. So you
Palm.
can tell a for the front and back side of your hand, just use one fingertip.
Yes.
And occupational therapy, you write the letter for her, right? But never ask for the patient to quit the job or to change the job. You can just send to the occupational
Mm.
therapist. They might be changing the nature of the job.
Okay.
And if you're telling the patient about wearing gloves, tell them to use non-latex gloves. In non-pharma, avoid the irritant. Use non-latex gloves, protective glove with cotton liners when dealing with chemicals and water. And remove gloves between clients to allow hands to dry, because in her case, mostly was her hands were used to stay wet. Reduce frequency of washing where safe. Do not extra dry your hands. Keep them moisturized. And safety netting you told. The third case, it was ectopic pregnancy. And Dr. Fareen, and the history was a kind of here and there.
Yes.
Even
Mm.
though you know this case, you somehow got confused. One important thing was STI, to rule out any STI history, because ectopic doesn't just
Mm.
come anyhow. She had a
Actually, I
history
have
of
just
chlamydia.
asked about discharge down below though. So they said they know
No,
his no complaint of discharge.
yeah, she doesn't have it right now, but history of any STIs is the causing a
Yeah.
factor of ectopics also, or any termination before, or any. First, we need to know if this is your planned pregnancy, any pregnancies before. If they had termination before, they would tell you. This was a stable patient of ectopic. Otherwise, you will also get emergency, like the pain going onto the tip of the shoulder, and they cannot tolerate it. And yes, IV diclofenac, doctor, we will never give IV diclofenac, and NSAIDs not even given in the pregnancy cases. So you corrected yourself giving paracetamol. IV lines will be saved. Number two, nil by mouth. Patient might be going for a surgery, so nil by mouth. And one-time pregnancy test at home is not reliable, so you will again repeat investigation over here. I'm going to do pregnancy test right now. And any case with a longer LMP, ask about the irregular periods, and also if she has done any scans. She didn't do any scan.
Yes, I just said that
Yeah.
refer to the oncologist. He will do some detailed scans and will check you.
If female patient with unilateral side pain since 2 days or since few days, long LMP like 7 to 8 weeks, then you are going in light spotting. This must be ectopic. Doctor, in miscarriage, the pain will be in the lower tummy, not on the right side. If it unilateral, then it must be ectopic.
Okay, so Dr. Musarat, if I'm saying like this that I cannot like confirm right now, maybe it's due to the topic or due to the miscarriage. So is this the wrong way to say?
Uh, no, it's not a wrong way. We can say in your condition, I am suspecting few things, but Dr. Fareen, here we have to tell like I'm most likely, not miscarriage, most likely you're suffering from ectopic. There are many things that can be a cause of this, but in your case, most likely it's ectopic pregnancy. And what is ectopic pregnancy?
Right.
Basically, it's the pregnancy that's not in your womb. It is basically outside
Outside
of
the
the
room.
womb. So I know even if you are afraid to lose the baby, it's not possible for the baby to grow outside the womb, and it is dangerous for you and for the baby also. So we need to admit you as soon as possible and take the pause because this is partially breaking bad, and you need to take care of the patient a bit and then accompany her with the husband and also if no if she came alone you can send with the staff, connect with the husband, tell her I want to see you after you get back from the hospital. This is important line over here. We need to show our care that I need to talk to you about because later few some contraception device advices or any medication review we need to do,
Yeah, I'll
otherwise it
tell
was
you
fine.
in this case that to just after visit the specialist, just come back to me. I will tell you all the things in detail.
Yes. Okay, so this was all for today. Thank you, Dr. Maida and Dr. Farheen.
Thank you.
Um,
Thank you, Dr.
any
Musarraf.
queries so we can talk and discuss? Thank you.